Welcome back. Joining me now are Kathleen and Tony at the Buffalo Pelvic Health and Acupuncture Clinic. Hi, ladies. Thanks for joining me.
Hi,
Thank you
thanks
for having
us.
us.
All right, tell us about the clinic and how it got started.
You want to start?
I'll start.
I always let her start.
We're a true team. I was running Queen City Health and Wellness, which was an acupuncture clinic, and I ended up meeting Kathleen by word of mouth. It's how you meet all the best people at all the best times. And Kathleen really was one of the first folks here in Buffalo to start really concentrating on pelvic health, which is a bit mysterious to folks and often underserved, often underrepresented. And I'll let her tell you all about that. But after getting to know her and her incredible reputation and all the good she was doing for women and underserved populations and treating things that nobody else was treating, I felt like it was a no-brainer that I wanted to be partners with her. So in October, we combined forces. We opened Buffalo Pelvic Health and Acupuncture Clinic. We've been up and rocking now for 4 months, and there's no sign of us slowing down.
Nice. Let's talk about why the focus on pelvic health and acupuncture and what makes you guys different in your field.
So I actually am a physical therapist, so I treat all things. I can treat back pain and shoulders and all of that. But after I had my first kid, it was actually my second kid, I was like super confused about my body. I was like, what's happening? So I was on this mission to like heal myself. And I went to PT school and really knew nothing about pelvic health. Like you had like one question on your boards about it, about like peeing your pants and nothing else. So I basically just started going to every course possible. And I was like, all right, I'm just going to start doing this because the things that we're treating are the things that really no one else is treating. So we're treating things like stress incontinence, which is when you pee your pants with coughing, sneezing, jumping, but then other things like pelvic pain that people really don't understand, a lot of men's health things like erectile dysfunction, again, things that were only really ever treated with medicine, we were able to treat in a more natural way. So we focus on pelvic health, but we're also physical therapists in every way possible. So it's one of those parts of the physical therapy world that seems like it's not really treating what it's supposed to be treating. It's one of those things where it seems a little bit more mysterious for people, but like we've been doing it for a long time and treating hundreds and hundreds of people every year. So it's pretty amazing.
Now, so your mission is to provide whole person-centered care. Talk to me about what you mean by that.
Well, in the medical world, you go to your OBGYN, your urologist, your cardiovascular specialist, your GI doctor, and you're sort of dividing the body into different systems. We sort of focus on not just the physical body and the physical symptoms, but also how does your psychological health impact your pain, right? How does your relationships with your children and your partner and your work affect your symptoms? How does the environment that you live in affect your symptoms? So we're not just looking at the physical presentation of symptoms, but we're looking at the whole experience of being human, because these things are all interrelated. And when we start to find these threads and these patterns, we can actually start to treat things in a much more holistic way. I'm sure Tony has a lot more to say on this.
Yeah, I mean, I think one of the bases for chronic pain, there are 51 million people in the US currently claiming that they live in chronic pain, and I'm pretty sure that that's an underestimation, right? The way that we collect data drastically skips people that are often the most impacted by pain. And one of the biggest impacts to pain are alienation, not having the psychosocial taken into account, and also not having practitioners that are talking to each other and looking at all the parts of your body as they relate to each other. When I see someone that's been in pain for 3 years and they're telling me, I had a tear in my shoulder, it's been repaired, why am I still in pain? One of the first things I do is I start looking at the amount of cortisol in their system. How stressed out are you? What's going on in your life? Cortisol inhibits healing. It inhibits pain reduction. I look at the support systems you do or don't have. I look at your posture. That list goes on and on. So not only are we looking at the whole person, but we're working in collaborative care. I always tell people, my job is not only to treat you. I connect you to resources, I refer out when it is necessary, or I connect you to my partners that can get you out of pain. This is a functional form of medicine. And what that means is I don't mechanize you. I don't say you are here because you are a shoulder in pain. I say you are a human being looking to be out of pain. How do I give you all the resources, the exercises, the hands-on care, the recommendations, and communication with my fellow practitioners so that you can actually exist as a human, be seen, be identified as a person that has been through a lot and cared for through that process.
Very interesting stuff. Ladies, thank you so much for coming in and sharing about what you guys do. If you would like to learn more about all of their services they have, as well as their upcoming classes and workshops, you can do so by visiting their website, bphac.com, or finding them on social media at buffalo.phac. Thanks again, ladies, for coming in.
Thank you.
Thank you so much for having us.